Welcome to the National Healthcare Safety Network, or NHSN, Hot Topic session. This presentation will provide you with updates to reporting on Multidrug-Resistant Organisms, or MDRO, and Clostridium difficile in 2015. The following presentation is focused solely on the substantive changes to MDRO and CDIF Lab ID Event Protocol. CDC's own in-depth assessment of NHSN, coupled with invaluable feedback from system users and subject matter experts, have led to important changes in definitions, criteria, and business rules. These updates are intended to enhance the system's performance and produce new benefits for patient and healthcare worker safety. Please visit the NHSN website to view the full protocol. First, changes to facility-wide inpatient or FAC-wide-in Lab ID event reporting. Acute care facilities are required to exclude and show proof that inpatient locations that have a different Centers for Medicare and Medicaid Services, or CMS, certification number have been removed from the monthly facility-wide inpatient denominator counts. Total patient day and admission counts from all patient care locations within the acute care facility will be entered, and then patient days and admission counts from patient care units with separate CMS certification numbers must be removed. This may include CMS Inpatient Rehabilitation Facilities, or IRF, or CMS Inpatient Psychiatric Facilities, or IPF. This documentation will occur in the MDRO and CDI prevention process and outcome measures monthly reporting for FAC-wide-in. Total patient day and admission counts from all patient care locations within the acute care facility are entered, and then patient days and admission counts from patient care units with separate CCNs must be removed from the MDRO and CDI summary counts and reported for FAC-wide-in. This may include CMS Inpatient Rehabilitation Facilities or CMS Inpatient Psychiatric Facilities. Hospitals will notice these changes on the CDI prevention process and outcome measures monthly reporting form. Specific guidance for completing this form can be found in the table of instructions. Here's a screenshot of the updated MDRO and CDI prevention process and outcome measures monthly reporting form. Facilities following FAC-wide-in surveillance are required to show removal of the counts from CMS IRFs and CMS IPFs with different CCNs. First, users must enter a total count of patient days and admissions, including all locations in the hospital. Next, users must enter those denominator counts for all locations minus those locations with a separate CCN, which may include CMS IRFs and CMS IPFs. Remember, for CDI patient days and admissions, counts for baby locations should also be excluded. Again, detailed guidance for completing this form is provided in the Table of Instructions document. Another change is related to reports from emergency departments and 24-hour observation locations. To facilitate accurate categorization of Lab ID events and to capture community onset cases, a location-specific outpatient reporting requirement has been added to FAC-wide-in Lab ID event reporting. Lab ID event reporting for FAC-wide-in now requires location-specific surveillance and reporting for that same organism and Lab ID event type from each outpatient emergency department location and 24-hour observation location, including pediatric and adult emergency department locations. Facilities must map their outpatient emergency department and 24-hour observation locations in the NHSN application. To give an example, if a facility is reporting MRSA blood-only Lab ID events at FAC-wide-in, the facility must also map each emergency department and 24-hour observation location and report MRSA blood-only Lab ID events separately from these outpatient locations. Likewise, if a facility is reporting MRSA all specimens lab ID events at FACWIDE-N, the facility must also report MRSA all specimens lab ID events from each mapped outpatient emergency department and 24-hour observation location. Facilities will no longer assign the admitting inpatient location to lab ID events when specimens are collected in the outpatient emergency department or 24-hour observation locations on the same calendar day as inpatient admission. Instead, the lab ID event is assigned to and reported from that outpatient ED or 24-hour observation location. Specimens collected from any other affiliated outpatient location should be reported to an inpatient location, but only if collected on the same calendar day as inpatient admission. A change for MDRO definitions is that CRE Enterobacter has been added as an organism for CRE reporting. For in-plan reporting of CRE, facilities are required to conduct surveillance for and report on all 3 CRE organisms, which include E. coli, Klebsiella pneumoniae, and Oxytoca and Enterobacter. These organisms are further defined in the MDRO and CDI protocol in the NHSN Patient Safety Component Manual. This means users will no longer be able to choose to monitor only one of the 3 CRE organisms for in-plan reporting. Since users must conduct surveillance for and report on all 3 CRE organisms, each organism is reported individually on the Lab ID MDRO and CDI event form. We've made several changes to CRE reporting, which include the following: addition of the carbapenem drug ertapenem, inclusion of only those pathogens that have tested resistant to carbapenem, and surveillance for CRE Klebsiella is limited to Klebsiella pneumoniae and Klebsiella oxytoca only. Also, the definition for CRE has been updated. All updates to definitions are defined in the MDRO and CDI protocol in the NHSN Patient Safety Component Manual. Finally, let's discuss changes to the questions. A new optional question is added to Laboratory-Identified MDRO or CDI Event Form 57.128 to improve tracking through the continuum of care for patients. The question asks the last physical overnight location of a patient immediately prior to arrival at a facility. Users must select from one of the following 4 options: nursing home or skilled nursing facility, personal residence or residential care, other inpatient healthcare settings, for example, an acute care hospital, IRF or LTAC, or unknown. This question is only available for community onset lab ID events in which the specimen is collected from an outpatient setting or collected less than 4 days after admission. Another new optional question has been added to the Laboratory-Identified MDRO or CDI event form to improve tracking through the continuum of care for patients. The question asks if the patient has been discharged from another facility in the past 4 weeks. The following options are available for users to select all that apply: nursing home or skilled nursing facility, other inpatient healthcare settings such as an acute care hospital, inpatient rehabilitation facility, or long-term acute care facility. This concludes the NHSN Hot Topics updates focusing on MDRO and CDIF reporting changes for 2015. For questions about these changes, please contact NHSN User Support at nhsn@cdc.gov.